CNA Review Book. Welcome to the quiz. Question 1. When providing perineal care for a female patient, you must carefully consider the direction of cleaning to prevent contamination and infection. As you prepare your supplies and explain the procedure to Mrs. Johnson, an 82-year-old resident with limited mobility, which specific cleaning direction should you employ to minimize the risk of transferring microorganisms from the anal area to the urethral opening? Option A. Clean in a back-to-front motion, starting at the anal area and moving toward the urethra. Option B. Use a side-to-side motion, alternating between the left and right labial folds. Option C. Employ circular motions, working outward from the urethral opening in expanding circles. Option D. Clean from front to back, starting at the urethral area and moving toward the anal region. The answer is D. Perineal care must always follow the front-to-back cleaning direction to prevent transferring bacteria from the anal area to the urethra and vagina. The urethra is located closest to the front, anterior, while the anus is at the back, posterior. When you clean from front to back. Question 2. During hand hygiene procedures, understanding the precise timing for different methods is crucial for effective infection control. As you prepare to enter the room of a patient on contact precautions, you decide to use an alcohol-based hand sanitizer from the dispenser outside the door. According to current CDC guidelines for proper hand sanitization with alcohol-based products, what is the minimum amount of time you should spend actively rubbing your hands together to ensure adequate coverage and effectiveness? Option A. 5 seconds of vigorous rubbing until the product feels dry. Option B. 10 seconds of continuous rubbing covering all hand surfaces. Option C. 20 seconds of thorough rubbing covering palms, backs, between fingers, and around nails. Option D. 30 seconds of methodical rubbing followed by air drying without wiping. The answer is C. The CDC recommends at least 20 seconds of rubbing when using alcohol-based hand sanitizers. This duration ensures complete coverage of all hand surfaces, including palms. Question 3. A patient recovering from a right-sided cerebrovascular accident, stroke, presents with left-sided weakness and hemiparesis. As you prepare to assist Mr. Rodriguez with his morning transfer from bed to wheelchair for physical therapy, you must consider the most effective and safe positioning of equipment. Where should you strategically position the wheelchair to facilitate the safest and most efficient transfer for a patient with left-sided weakness? Option A. Place the wheelchair on the patient's affected left side to encourage use of weakened limbs. Option B. Position the wheelchair on the patient's stronger right side to maximize stability. Option C. Situate the wheelchair directly at the foot of the bed for a straight-line transfer. Option D. Align the wheelchair parallel to the head of the bed for lateral transfer assistance. The answer is B. The wheelchair should be positioned on the patient's stronger right side. This placement allows the patient to use their stronger limbs for support during the transfer. Question 4. When conducting a comprehensive set of vital signs for a newly admitted patient, the sequence of measurements can impact the accuracy of individual readings. As you approach Mr. Chen's bedside with your vital signs equipment, you consider which parameter should ideally be measured first to prevent alterations caused by the measurement of other vital signs, particularly when the patient is unaware you're assessing this specific sign. Option A. Begin with oral temperature using a digital thermometer placed sublingually. Option B. Start with radial pulse assessment at the patient's wrist while engaging in conversation. Option C. Measure respirations first by discreetly observing chest movements after pulse assessment. Option D. Initiate with blood pressure measurement using an appropriately sized cuff on the bare arm. The answer is C. Respirations should be measured first because they are the only vital sign that patients can consciously control. If patients know you're counting their breathing. Question 5. The use of assistive devices during patient ambulation requires understanding their primary purposes and proper application techniques. As you prepare to assist Mrs. Williams, an 88-year-old resident with generalized weakness and balance issues, with her first ambulation attempt since hip replacement surgery, you secure a gait belt around her waist. What represents the fundamental purpose of utilizing a gait belt when assisting a patient with ambulation, particularly one with mobility challenges? Option A. To completely prevent the patient from falling during ambulation activities. Option B. To provide the CNA with secure handholds for offering support and stability. Option C. To enable the patient to walk at a faster pace than would otherwise be possible. Option D. To reduce the amount of physical assistance required from healthcare staff. The answer is B. A gait belt's primary purpose is to provide the healthcare worker with secure handholds to offer support and stability during transfers and ambulation. It creates safe grasping points that allow the assistant to guide. Question 6. While assisting a patient with advanced Parkinson's disease during the noon meal in the dining room, you notice subtle but concerning signs during the feeding process. Mr. Thompson, who has known dysphagia, begins coughing intermittently. His voice becomes gurgly after swallowing, and he appears to be having increased difficulty managing his food bolus. In this situation, what immediate action should you take to prioritize patient safety and prevent potential complications? Option A. Offer him a small sip of water to help clear the food particles from his throat. Option B. Stop feeding immediately and maintain the patient in an upright position. Option C. Encourage him to take smaller bites of food and chew more thoroughly. Option D. Ask him to cough forcefully several times to expel any trapped material. The answer is B. When signs of aspiration risk appear. Great job! Don't forget to subscribe. Bye.